Thank you, everybody, for coming back. I hope you had an enjoyable lunch. My name is Renée Fry-McKibbin. I'm a professor of macroeconomics in the Centre for Applied Macroeconomic Analysis. You won't see my name on the program. Myra Hamilton was supposed to be the chair today, but she's unwell, so we're giving her a shout out because I believe she's watching us through the video. So hopefully she can send through all the hard questions through the chat a little later. So it's so great to be back in person at a conference. We have 3 papers today and then some comments followed before we have our question and answer session. Our first speaker is Sharon Parker. Sharon is a John Curtin Distinguished Professor in Organisational Behaviour in the Faculty of Business and Law at Curtin University, and she's a CEPAR Chief Investigator. Sharon is a world-leading researcher on the topic of work design, as well as other topics such as proactivity, mental health, and job performance. She is a recipient of one of the most prestigious research fellowships in Australia, the Australian Research Council Laureate Fellowship. She's a Fellow of the Academy of Social Sciences, a Fellow of the US Society for Industrial and Organisational Psychology, and her work has been cited more than 26,000 times. She's also been named as one of the top 2% of scientists by Stanford University. She's the director of the Centre for Transformative Work Design, and she's attracted competitive research funding worth over $40 million. I think you need to work a little bit harder on that. Please join me in welcoming Sharon to give her presentation.
Thank you so much, Renée, and thank you, John, for organising today, for Silke and Rosanna for your great back support, and Warwick, of course, for hosting the event. I'm going to present a little bit more of an organisational perspective on the mature worker challenge that we've been talking about this morning. And I'd like to acknowledge my co-authors, Daniela, Lucinda, Jane, Evan and Leah, who helped put these slides together, and also acknowledge the work of the Sydney team, who are reflected in some of the research that I will talk about. I guess this is the way that I'm seeing the world at the moment, which is that this is a challenging problem that requires a multi-level response. And I guess we've heard this morning about national level policies, how we might change taxation, pension age, retirement age, training and employment schemes, the Fair Work Act and so on. And I think, Marianne, you called these, what was your bottom level thing in your model?
Mandate or legislation in the public.
Yeah, so that's really that level. And then the level, though, that I'm going to focus on is more what is it that organisations actually do. So this includes the policies of the organisations, and I think what you've referred to as the management discretion, which is the sort of practices, the leadership styles, and so on. And of course, we could also be looking at this problem from a more individual level perspective, such as the health of individual workers and so on. So the focus is on the organisational level. This is important because the macro level policies are sort of no good if we don't also have those complementary organisational level actions. So, you know, if you've got a later retirement age, but you can't get a job because of age bias, then the later retirement age policy is not very helpful. It's also a good complement to those individual level initiatives. So if we make all the workforce healthier and more educated, but they can't get the opportunity to work, then that's sort of wasted as well. And also the other side of the coin is there's lots of evidence that if people work in good quality jobs, they're actually going to be healthier. It's protective of health, mental health in the workplace. So these things come together and work together. Importantly, we also know that many Australian organisations are not very good on this front, and we'll present some evidence to that as we go. And I'm just putting here the summary that we had from our Mature Workers in Organisations report that we did. You know, if as a society we want to aid Australia's economic success by harnessing the full potential of the mature workforce, we need to create different sorts of organisations and workplaces than those that typically exist right now. And that's really the central message of the presentation today. So we're going to talk about a model that Daniela and I worked on, which sort of synthesises a lot of different research on this topic. So when we started out in this field, you know, like every good researcher, you do a lit review and you find out what's out there. And actually there's a lot already written on this topic. And the way that we made sense of it was to develop this 3I model. And that's what I'm going to unpack a little bit for you now. And in a sense, these 3 I's, they are what we would call meta-strategies, the sort of groups of strategies that organisations can use. So the first meta-strategy we call include. And so this is about the things that you can do in organisations to reduce the discrimination that people might face and those barriers to participation. But it's not just about reducing discrimination, it's also about enhancing inclusion, which is not necessarily the same thing, but that's about making it a welcoming environment or positively recruiting, for example, mature workers into the workplace. I do want to just talk about theory just for a moment because it's important. So what informs this perspective is social psychology research in particular, which has identified that, you know, we live in this complex world with a lot of things happening, and one of the ways that we simplify the world is to categorise people. So when I look at RAF, you know, I see, I was going to say young man. You know, so I see a man, I see someone young, younger than me at least, you know, and I see, you know, certain nationality, etc. And I categorise him in these ways. And that's what we do in order to sort of cope with the complexity in the world. But that can have some downsides. It's got lots of good sides, makes it possible to operate in the world, but it's got downsides. And the obvious ones are that we categorise people in certain ways, and then we can have also this thing called the similarity attraction theory, which is that we tend to like, frankly, people who are like us. There's a lot of research evidence that is so. So we categorise people, and if they're different to our category, that's going to invoke possible bias. Another thing that creeps in there is these stereotypes. So we have these stereotypes about these social categories, and they too can influence the way that we treat people in the world. So these sorts of theories would lead us to expect some bias, and we do indeed see some. So as an example, some of our associate investigators in CEPAR, a meta-analysis of 87 studies showing across those 87 studies that older workers tend to be evaluated less positively just in general, their general performance. They tend to be evaluated less positively in terms of their interpersonal performance. They're less likely to be selected for jobs and so on. In our own research, for example, we asked this question, my organisation is monitoring the skills of workers irrespective of their age and providing training to upgrade and maintain their skills. You can see from the graphs there that the 55 to 64-year-old and the 65-year-old men really score quite low on that aspect. In other words, they're saying they're not getting that equal access to training. There's an anomaly with the 65-year-old women, which maybe we can come back and talk about a bit later. In another study that we conducted, we looked at these stereotypes. What are the stereotypes of mature workers? And these were the 10 strongest stereotypes for mature workers. And I've put there in green the positive ones. So there's some positive stereotypes of mature workers, that they're wise, they're good role models, they're secure, they're loyal, they're good attenders and things like that. But there's also some negative ones. And as you can see, the theme is very much around change. They rely on outdated knowledge, they're stubborn and stuck in their ways, uncomfortable with technology, resistant to change, don't keep up with changing methods, and are closed-minded. And what we showed in our research is that, so clearly mature workers are seen as less adaptive to change, but we also showed in this piece of research that adaptivity is actually a very prized characteristic. So people want adaptivity in the workplace and they associate it with high performance. So you can see why with these sort of stereotypes that people have, that sometimes they tend to get excluded from the workplace. It is important to note that this is a stereotype. There's actually no evidence that mature workers are less adaptive. And actually, in our research, at least in terms of people's own perception of their adaptivity, which might be different to their bosses, I agree, but at least in terms of their own perception of adaptivity, actually you can see they see themselves as really quite adaptive compared to the younger workers actually struggling. And there is some evidence during COVID, and it comes back to what you said, Marion, that, that mature workers were very adaptive at that time. So what do we do to build this inclusion? So what we need to do to prevent the bias is we need to remove those age-related barriers to employment and promotion and development. And it's not just about having rules and legislation, it's also about tackling those more overt forms of discrimination. So for example, you couldn't advertise, it would be illegal to advertise that we want a young worker unless you can prove that that's essential for the performance of the job. So that's an obvious thing, you should take that away. But a more subtle form of discrimination is an advertisement like this, where they're asking, you know, we're a young and hip team that loves to work hard and have fun, perfect fit for recent college grads. That is a more subtle form of discrimination against mature workers. So we need to remove the bias, but we also need to promote the inclusion. So actively take steps to include people and help them to feel that they belong. So actively recruiting mature workers, for example, the ANZ Bank has done this. What you're trying to do here is you're not trying to treat everyone the same or assume that everyone is the same. What you're trying to do is recognise that people are different and appreciate those differences. That's what inclusion is really about. We sometimes think that inclusion means everybody should be treated the same, but we all have different needs, and this is part of the point, right? And so we need to recognise those different needs and appreciate people irrespective of those differences. And one of the things that we could do to intervene here is to train leaders to be more age inclusive. And this is actually what Eva is going to be focusing on in her PhD. So that's what include is. So include is all about welcoming, accepting, letting mature workers come in and be accepted. What is individualise about? Well, individualise is about accommodating those special preferences and needs that mature workers have. So I just said it's not about treating everyone the same. It is about recognising people have different needs. And this sort of theoretically comes from lifespan psychology and the evidence that actually, on average, as people age, they change in particular ways. And they get gains in things like wisdom and knowledge, but they also have losses in terms of things like memory processing speed, for example. And people's preferences change too. Socio-emotional selectivity theory is all about how, as people mature, they tend to prioritise more emotional needs than relative to when they're young. So the individualised perspective is all about accommodating these different changes that people have as they go through their lives and careers. And you can see there, and I know that Donald's going to talk about this later, so I won't talk about it now, but some of those gains, this is research showing, for example, that people get more conscientious as they mature. They get more emotionally stable as they mature, but they also have some losses. One of the things that's really important, though, is not everybody changes in the same way. And if we were drawing graphs of, for example, memory decline, on average, yes, there is a decline in working memory as people age, but there's a lot of individual variation. And some individuals manage to maintain a high level of working memory, particularly, I have to say, individuals working in complex jobs where they use their brain, like many of us, so we should be okay, hopefully. But there's a lot of variation. And that's why we call this meta strategy individualise, because it's not about okay, you're old, so you're going to need this. It's about let's accommodate the individual needs of the worker. And by the way, this should work for more than just mature workers too. In our research, again, we showed mature workers have different preferences, tending to prefer more intrinsic reasons for working. So just as a quick one, for men and women aged 65 plus, the top reason for continuing to work was to stay active and productive, whereas the top reason for workers under 45 was getting the income from the work. Workers aged 65 plus were more likely to say that they work because they enjoy it or it gives them a sense of purpose compared to their younger counterparts. But what's the current reality in terms of individualised? Do we have those sorts of things happening in organisations? Well, not really. So, for example, these are just example results from our MWAS survey. About 65%, two-thirds of workers aged 55 to 64 reported that alternate career paths with a specific focus on employees of different ages are not available in the organisations that they work for. So that's two-thirds of workers saying there's not much accommodation really for their changing careers. Again, almost two-thirds in that same category reported that their employer does not offer phased retirement programs. 60% of employees in that same category reported that there are little or no opportunities to have their jobs redesigned or to transfer to a less strenuous job. So some evidence that organisations are not really individualising the work for mature workers. So what can we do? Lots of things. We can redesign the work. We can give mature workers more autonomy. Lots of evidence that mature workers particularly value autonomy in their work. More flexibility, as Marion has talked about. We can do things like allow mature workers more opportunity to work on tasks that require crystallised intelligence, which is sort of stored up knowledge. We can accommodate physical changes. And I know that Donald's going to talk about BMW as an example, so I won't talk about it more. We can introduce those individualising HR practices. We can encourage people to craft their work. So that means encouraging people to build on their strengths and to use their skills and allowing them the latitude to do that. And we can train leaders to treat people as individuals and manage them as individuals. Just want to very quickly share some research, and this is research led by Lucinda, who is right behind Eva up there, one of our PhD students. And she showed the importance of leaders in this process. So if you've got supportive leaders, and in this study, supportive leadership is defined as considering the individual needs and feelings of your workers. So if you've got supportive leaders, we showed that you're actually less likely to want to leave, so lower turnover, and less likely to sort of mentally withdraw from your career because you experience less age bias at work. But we found that that effect of supportive leadership was the strongest for mature workers. They benefit most from it, and also was stronger in STEM, so in science, technology, engineering, maths context, which makes sense because in STEM, if we think about what STEM is, it's all about change and technology, and that's where those negative age stereotypes are probably going to be the strongest. So what you can see from this little figure here, and you can see bias up the side, that the people who are experiencing the most bias in this sample are the mature workers who haven't got very supportive leaders. But if you're a mature worker and you've got a supportive leader, then you actually don't experience any more bias than a younger worker. Whoops. Last part of the model is the integrate component. So one of the things that happens as you get a more mature workforce, by definition, you also get a more age-diverse workforce. So you get a workforce that's composed of young, middle-aged, mature people. And that means you've got to pay attention to how those people work together as a team. And that's what this integrate strategy is all about. It's about creating work, designing work so that you've got good interactions between these age-diverse members. And theoretically, this comes from a lot of theory around things like innovation. So a lot of evidence that we get more innovation when you can draw on a bigger pool of knowledge and experience and perspective. So if you've got a diverse group of people with different ages, you've got the opportunity to draw on that diversity and then get more innovation, better solutions. But you've also got a risk of conflict, right? Because you've got people that are in different social categories having to work together. So you've got the opportunity to harness the diversity, but you've also got the risk that, in fact, it might create conflict. And from our survey, again, we know that if we look at things like knowledge sharing, so sharing knowledge from younger colleagues to more mature colleagues, it's pretty low for the mature workers there. In other words, they're not feeling that people are drawing on their knowledge very much, which is sort of a shame because of the extra knowledge that they have. And here's another example. Mentoring and reverse mentoring is an example of a way you could try to encourage better integration across these diverse groups. And this shows the percent of people who are saying they don't have any access to mentoring or any incentives to mentor other people. And you can see that the numbers of people that are saying they've not got this is much greater for the mature workers. What can we do? We can train workers to actually harness the diversity to work more effectively with people from different social categories. We can create better knowledge sharing structures. We can foster high trust cultures, and we can put in place programs like mentoring and reverse mentoring. Just to give a quick example from a case study for one of the organisations that we're working with, a multinational professional services firm, the senior leaders there noticed that the young team that they had in place was struggling. They had problems with workload, over-promising, under-delivering, excess overtime, blaming each other. So things were falling apart, basically. So what the senior leaders decided to do was to bring back an ex-employee who had some of the knowledge and wisdom about how to manage clients, how to work together effectively. And you can see this is the mentor talking. He's saying things like, my role is to try and impart some grey hair, for want of a better term, onto some of these guys. So the team leader uses me as a sounding board. And, we trust each other. I understand what he wants, what he needs, and I'll try and help him out as much as I can. And the way that these younger colleagues have engaged with me is very positive. So they look for some experience and guidance. So that's an example of sort of reverse mentoring, or an organisation doing something a bit creative to try and build better bridges between mature workers and more senior workers. I won't go into detail here, but we measured all of these strategies and whether people felt they have them in their workplaces, and then we statistically link those to outcomes. So, for example, intention to leave, and we find that all of these meta strategies and particular elements within them predict intention to leave. So you can see, for example, if you've got better leadership quality, you're more likely to stay in the organisation. But they also predict things like life satisfaction and so on. And I'm just really saying that to say these are things people value in organisations, and they influence their behaviours, and these behaviours include staying longer in the work. The next phase of our research is really to move more into interventions. So I've given examples of the sorts of ways that we could address each of these three I's, and that's what we're really focusing on as we move forward. Okay, let's actually get organisations to put these in place, and then let's evaluate them. And that's really important for two reasons, and one reason is just pure causality. We can really only know if these things work if we try them out and measure them. The other, though, is also just from a practical perspective, organisations want to know what works. And if we do these interventions and systematically evaluate the impact, then we can really give them good advice about what works. Just as an example, we're working with a local council. We do a diagnosis on all the aspects of the 3I model that I just went through. We identify the red flags, the issues, and then we have workshops with the people, the managers and the people in the organisations that are relevant, and then we identify possible areas of intervention. So in this case, 3 different interventions, and one to tackle the fact that the individualised aspect was particularly poor. I won't go through the detail there, but that's the sort of approach that we go through. So that's a bit of a whirlwind tour through the 3I model and how we use it. Let me just briefly summarise, I guess, the points that I'm trying to make. The first is that it is really important to look at what organisations do, as well as what we do at that national government-mandated level. And it's important for the participation and the performance of mature workers. And Mark made a point earlier about productivity. So part of the issue here is not just about retaining workers, it's about retaining workers that are productive, right? So we also want to pay attention to maximising the performance of the mature workers. So one way to make sense of the many strategies and practices and policies and theories is this sort of 3I model that I've talked about. Include, which is about acceptance of mature workers, accepting their contributions. Individualise, which is about accommodating the unique needs that they might have. And integrate, which is about recognising that with mature workforce comes diversity, and therefore we've got to look at how you connect people and have those diverse members sharing knowledge. There is much room for improvement in many organisations. And what our current focus is to work with organisations to diagnose, intervene and evaluate change in those strategies. Really what we're trying to do here is create evidence and evidence-based resources that could be used to scale this up more broadly. So obviously we're only working with a small sample of organisations, but what we're trying to do is generate the evidence that hopefully other organisations could embrace. So the challenge for you today is going back to the multi-level response, is I think it would be good to think about, are there additional national level policies or strategies that might foster and enable organisational level action? So we've talked about regulation, but what else could we be doing to get organisations to take some of this stuff more seriously? Is it about incentives for organisations? Is it about different sorts of training models or something? I don't know. So that's the challenge that I will leave you with. Just to finally end with a quote that I thought was apt in terms of what we're saying, that, to find joy in work is to discover the fountain of youth. And actually, really, what we're arguing here is that if mature workers stay in work longer, it's not just good for the economy, it's actually good for the workers. A lot of evidence about the role of good quality work in facilitating successful ageing. So may we all find joy in work. Thank you.
Great, thank you, Sharon. Our next presentation is a joint presentation by Daniela, Andrei and Jane Chong. So they both work at the Centre for Transformative Work Design at Curtin University with Sharon. Daniela is a CEPAR Senior Research Fellow. She joined in March 2018 after working for 5 years as a postdoctoral fellow at the UWA School of Psychology and the UWA Business School. She completed her undergraduate and postgraduate studies in psychology in Romania, where she worked as an assistant professor before receiving a Group of 8 scholarship to move to Australia. Daniela's research interests revolve around work design with a focus on the multi-level antecedents of work design as well as on work design consequences for I can't say performance. I'll work on that. Well-being and safety. Jane is a CEPAR research fellow as well. She joined as a research associate in 2020, so I'm guessing this is one of her first big conferences as an academic, given the last year. After completion of her combined PhD and Master of Industrial and Organisational Psychology at the University of WA. In April 2021, she joined CEPAR as a full-time research fellow with a keen interest to conduct rigorous research while partnering with organisations to support the successful ageing of the mature workforce. So I'll invite them both to come and give their joint presentation.
Hi everyone, thanks for having us today. So Daniela and I today will be talking about COVID-19 and mature workers based on our research, but as an introduction, we thought maybe I'll introduce sort of the wider research that's outside of the CEPAR team for now. So to start with, I thought it might be, I guess, important to talk about why it is important to think about mature workers during COVID-19. So as we know, the aging workforce presents both challenges as well as opportunities for individuals, organizations, and the economy, as we've sort of talked about throughout the day. And actually, prior to COVID, mature workers has already faced diverse economic, social, and personal challenges at work as well. Actually, a report by the Australian Human Rights Commission says that more than a quarter of Australians aged over 50 actually experience age discrimination at work. And concerningly, those who have experienced age discrimination, a third of them actually give up looking for work. So they actually don't re-enter the workforce. And another report by RE as well looked at the employer's perspective and found that actually 68% of them surveyed were reluctant to employ people over 50, so that's quite concerning. So this is all pre-COVID. And when COVID hit, we sort of quickly realized that the risk of severe illness from COVID-19 increases with age. And this crisis, combined with the aging workforce and higher morbidity rates among those aged 60 and above and increasing with age, presents sort of a particularly unique combination of factors for us to investigate and look at. And we've also found that COVID-19 has really amplified the barriers to employment for mature age workers as well. So it's quite important to look at. So I'll start, as I said, with the wider research on COVID-19 and mature workers. And in terms of government and industry and the media, there's been a lot of talks. So ABS data shows that youngest and sort of the oldest cohorts bear the brunt of unemployment during the pandemic. More than 50% of older workers have had difficulty gaining employment or being retained during COVID. There's industry data that shows that there's a compound impact of COVID-19 and the public health response for mature age and low-income people. So that's a particular group to look at. Forbes also reported that older workers may especially benefit from paid sick leave policy. So if you're thinking about casual workers, for example, who don't have the paid sick leave and they want to go to work, and so that increases their chances of getting COVID and then falling ill. So that's sort of the government and industry, or a snapshot of it. In terms of academic research, I just want to highlight that at the moment, there are a lot of commentaries and sort of theoretical propositions. Not too many empirical research has been published yet, but hopefully more to come, as well as from us as well. But in terms of commentaries, researchers have sort of highlighted that organizations and policymakers shouldn't be too quickly to customize workforce policies to people of different ages without the evidence backing it. So for example, there might be suggestions in the media that work from home policies may be especially beneficial for younger workers, yet this remains an open and untested question empirically. There are pitfalls of generations management, so there are talk about the COVID generation at the moment, but when we look at generations rather than specific age and cohorts, we lose a lot of the variability within that generation that Sharon has just talked about as well. So we're really encouraged to focus on developing interventions, evidence-based interventions that are rigorous to mitigate age-related effects, which is what we're doing, so that's great, I think. And so some other examples of theoretical sort of propositions that are being discussed in the academic literature would be characteristics of this pandemic and their pathways to influence on more mature or older workers. So as we age, it's not just about extra fine lines, gray hairs, but unfortunately, it's also it sort of brings us closer to death. And so, in terms of mortality salience, a pandemic really puts one's mortality into sharp relief, and workers and this may have impact on mature workers because when we're sort of reminded of death, we tend to go back to what we really highly value in our life and really hold on to that a little bit more. And so research is saying maybe that might really impact how mature workers navigate retirement. So those who put work and put a high degree of importance into work may want to stay in work a little bit longer, whereas those who prioritize other areas of their life a little bit more may choose to exit a little bit earlier with this sort of constant reminder from the pandemic. It also highlights the role of remote working and learning as well. So there could be advantages due to greater autonomy and flexibility that mature workers do appreciate versus drawbacks from the reduced opportunities for informal social interactions that a lot of mature workers have sort of a belongingness motive as well. So there's like that sort of tension there, and Marion also talked about that as well in terms of the social interaction. Again, it also highlights the importance of the people's motivation as well as their capacity to develop new work skills. We had to pick up Zoom and sharing your screen on the thing. That still gets me until today. I can't share my screen properly. But it just highlights the importance of a lifelong learning that we've sort of, again, spoken about today as well. And so researchers are saying that although getting that new skill and lifelong learning is really important, there are sort of a lack of, again, empirical research as to how mature workers do pick up these skills and actually apply them. And the third one would be unemployment, job search, and work exit. We know that older workers face unique challenges when it comes to effective job search strategies and with biases and things like, and obstacles. So organizations are sort of encouraged to support mature workers in this area as well. So I've talked about commentaries and theoretical propositions, but in terms of the few empirical research that I can find, we know that age was negatively associated with distress in the first week of lockdown, prior linked to COVID. In summary, older workers responded more effectively to measures that counter COVID-19 as well. This is in research in Spain, and this goes back to the lifespan perspective and that older workers have better emotion regulation. As I talked a little bit about before, higher rates of death among the elderly triggered some older workers to start retirement planning, whereas others worked more or came out of retirement to help with the high demands in healthcare, for example. So again, that variability in people's behavior. Importantly, personal resources such as self-efficacy, resilience, and things like that help make the COVID-19 career shock, their loneliness, and psychological distress a little bit more manageable. So I guess from our lens, in terms of mature workers and organizations, it's important that organizations can help improve these self-regulation strategies and personal resources through HR, through the strategies that Sharon talked about, such as HR practices, encouraging job crafting behavior, and designing good work. So that's all from me in terms of wider research. Now I'll hand it over to Daniela to talk about what we've done in this space.
Yes, just checking that on. Yeah, all good. Yeah, so thank you, Jane, for this overview. I think it's very challenging to actually see what's happening in research because everyone at the start of the pandemic started to collect a lot of data. And I think the challenge is that most of us, and we're in the same boat, are still trying to figure out how to make sense of now all the data that we've collected and try to see the trends. So I will aim to complement a little bit what Marion and Sharon and Jane presented today with giving you a little bit of a glimpse of what is the empirical data that we, not just some of the research that we've been doing. I just realized that I have also not a commentary in there, which is not empirical data, but most of it is empirical data. Very similar to all the academic kind of world, at the very beginning of the pandemic, we started with a commentary piece, an analysis which was led by Lucinda and Sharon, where I think that the novelty that or the focus that they brought in that piece was the idea that we need to also focus on what happens in terms of cultural kind of processes and climate at work, because much of the research, as you've seen from Jane's review, was focusing on the individuals and how they react and how they're impacted from an individual level. But what Sharon and Lucinda were proposing there is the fact that together with that, we're going to see a lot of attitudinal change and a lot of challenges in implementing good or maintaining good working climates. And that's going to compound the tendencies that we can see at the individual level. The evidence that's emerging, even from our research, and I'll move to it in 2 moments, is supporting that idea that the pandemic might have exacerbated some age discrimination. And I'm also going to show a little bit how actually we can see also a gradual decrease in the quality of work, at least in the data that we are collecting. So to help with the empirical support for how the mature workforce was impacted during COVID, we conducted a longitudinal survey, which covered the entire Australian workforce. It's not a representative sample, it's a convenience sample, but it covers participants from all over Australia, which were surveyed at 3 time points. One was in June 2020, when most of the country was in full lockdown still. The second time point was in November 2020, so 6 months after the first time, where we had achieved 0 locally acquired COVID cases, and there were just small outbreaks quickly contained. And actually, just this Monday, we closed the 3rd time of the survey, which we hope is going to look at almost coming back to normal. It's a balanced sample in terms of gender, and it's a focused sample on mature age workers. I'm going to give you just a little bit of a flavor of what we're seeing, and I'm going to organize it in terms of the 3 I's. But before that, a few COVID-related things that we looked at. And one major thing that we started with was the idea that many people are going to be redeployed or reassigned. And we were thinking that particularly older workers are going to experience this more. Data from our first survey actually suggested that only about 10% of people went through these processes of redeployment, reassignment to different jobs. About half of them were back to normal at our second time of data collection. So not a huge, it wasn't as huge of a phenomenon as we were expecting, but if you look at the characteristics of their redeployment, you can see that these people are at risk because the characteristics were negative. More than 50% of people reported the reassignment being involuntary, feeling pressured to accept the reassignment, not receiving training. 77% of them did not receive training for the new job. Their payment was reduced, and the job was very different, which kind of paints a picture about, yes, it's just 10% of this large sample, but these are completely at high risk for maybe exiting the workforce. So it's interesting to look at. Also, another thing that we can look at is the perceived vulnerability of contracting COVID, which was higher as expected in June 2020. But what we can also see is that, as expected, it reduces, but it reduced at a lower rate for female workers, probably due to their working in industries like Raf has just highlighted in terms of healthcare and education, and where the risk remains higher. When we look at attitudes towards work and retirement, one interesting thing that we've noticed as an opportunity factor maybe is the fact that people have started to appreciate work more. And we can see that that's increasing over the 2 time points that we could analyze for this presentation. So more than half of our sample are saying that they appreciate their work more, and that trend was increasing by the second data time point. They've obviously felt more grateful to have employment also because of the increased risk in the market perceived. But also they a trend towards considering retirement increased also, with about 15% of our sample noting that they would have liked to retire but didn't, were not able to for various reasons. Sharon just mentioned the model, so I'm not going to go through it again, but I've organized a few of the results on the 3 I's, so to give you an idea of how, at least based on this sample, organizations are doing or seem to be doing in these areas, noticing that this is from the employees' perspective, so their perceptions and their attitudes of how the things are going in this area. So for include, when we actually look at the age bias, like average level of age bias didn't change too much. Also, they didn't change too much when we compare with our benchmark from 2019, which was completely before COVID. But when we asked people whether they perceived that age bias increased during COVID, about 10% of them on average say yes to that. So although when we ask them how much age bias, the levels, at least they perceive that COVID kind of exacerbated that. When we look at what the organizations are doing, so inclusive HR practices and age diversity climate, that it's a result of that, we actually can see a decreasing trend. And it's decreasing compared to 2019. For age diversity climate, quite steep. The June 2020 and November 2020 is linked data, so the same individuals, repeated measurements, and that decrease is slower, but it's significant. So the trend is consistent around that. In terms of HR practices, we can see that the perceptions about fair employment decisions like recruitment and retirement has improved compared to our benchmark. But when we look at the linked data, it's again a decreasing trend in there. And the training and performance feedback to mature workers is stable, slightly decreasing. So the idea is here that we can see that organizations might struggle to actually create that positive work environment. And it's not surprising considering that maintaining positive cultures are acknowledged to be hard to do when people are not working in the same place, working from home, and you have to adapt all those processes. In terms of individualized, so this is more about quality of work, we look a little bit at people's work design and smart work design during COVID. Again, this applies to all the data that we see. It's not huge differences, but the trends are very consistent. And what we see is that on average, the job resources are reducing. So relational work design, autonomy. Surprisingly, autonomy, work schedule flexibility is significantly reduced from June to November. It's either because people are starting to come back to work or because actually working from home didn't allow too much work schedule flexibility if you have to kind of be in meetings with others and adjust to different time frames and things like that. and the demands are increasing. Again, this is significant trends in linked data from the same individuals. The individualizing HR practices, again, overly a decreasing trend, both compared to benchmark 19 and in the linked data, with the only exception, as expected, being the flexible work options that were revealed as increased compared to and maintaining stable. In terms of integrate, the two integrative practices that we looked at were again around mentoring and incentives for mentoring. The same trend, reduced compared to 2019, reducing trend and significant in linked data. When we look at the intergenerational processes, these differences are not significant, but we do see a different trend in terms of knowledge sharing by others. So this means colleagues sharing knowledge with older workers. And older workers reported that their colleagues shared more knowledge with them, but actually they sought less knowledge from them. So colleagues sought less knowledge from mature workers, which might be damaging because, as Sharon mentioned, the motivational changes are towards older workers valuing more kind of intergenerational contact and generativity motives. Why should we care about this? Again, this is predictive analysis looking at what happens over time and controlling for the initial levels of those outcomes. So even when we control for those outcomes at time one, having age diversity, positive age diversity climate and inclusive HR practices reduces career withdrawal, which we know that it's a very important driver of retirement, and reduces employee burnout, and increases future focus, psychological well-being, work engagement, and proficiency, which we know that are drivers of people staying in the jobs. Similarly, when we look at the work design and the quality of work design, again, I'm finishing now, we see that those are drivers of important, good, positive things, and especially the relational work design, which might have been impacted during the COVID. And one last thing that I want to leave to you is the fact that if we see all these kind of trends of reducing the quality of work, what we see is an increasing trend in the performance, work performance of these people. So these people do not report reducing their performance, actually maintained or increased it. So they might be doing better work with less resources, which is not sustainable over the longer time. So I think it's really important, as Sharon said, to think about what are the things that create better work. And this is important to note that, as Marian mentioned, when we look at the employer perspective, and it's not linked data, but their take is that things are very positive. When we look at what employees themselves perceive, it's a decreasing trend. So that might be an indicator that whatever the employers are doing is not always translating at the individual level, and we have to think about how to improve that. So that's pretty much it. Thank you.
Our next speaker is Christine Hayes LaBond. So Christine is a research fellow in the Society, Cultural and Health Group at the ANU's Research School of Population Health. She holds a PhD in cultural anthropology and constructs qualitative research on the cultural and social determinants of health across a range of topics, including aging and labour participation. She is currently contributing to the ARC linkage project, Working Longer, Staying Healthy and Keeping Productive, which examines the intersection of aging, health and labour participation in Australia. Christine?
Good? Okay. Thanks, Renee. I'd like to begin by acknowledging the traditional owners of the land on which we are meeting today, the Ngambri and Ngunnawal people, and pay my respects to their elders past, present, and emerging. So today I'm going to present findings from an ARC linkage project based at the ANU's Research School of Population Health called Working Well, Working Wisely. It looks at the intersection of aging, health, and labor participation and asks the overarching question, how can we make longer working lives more feasible and fair? Our research team is built through partnerships with multiple departments and institutions to create a program of research that brings together multiple perspectives across 5 interrelated sub-studies. These include an analysis of 17 waves of the household income and labor dynamics in Australia, or HILDA, survey data, to look at the relationships between jobs and health. In-depth interviews with 60 pink, blue, and white collar workers aged 50 to 71 who are managing a health condition while also working. A workplace manager survey of over 1,000 managers of medium and large businesses in Queensland, which asked about experiences and attitudes surrounding employing older workers. A review of domestic and international policies on mature age employment, drilled down to 5 countries with demonstrated good practice, precedents, and a Delphi study seeking expert insights into the challenges related to mature age employment and health and possible solutions. 3 key themes have come through the data across these 5 project sub-studies, which we believe are relevant to employment and social policy success. Number 1, longer lives don't necessarily mean healthier lives. Australians born now can expect to live about 30 years longer than those born at Federation in 1901. But this doesn't mean 70 is the new 40. There are some whose healthy life expectancy has increased, but there is a large group whose poor health, often due to rising rates of obesity and chronic diseases, leaves them behind. Number 2, policy success depends on jobs and health now and jobs and health in the past. It's both now and in the past that matters, because poor health drives people out of the workforce, and this influence increases as people age. Jobs and health also interact and affect each other. The effects accumulate, so policy needs a preventative as well as a current focus. Number 3, workplaces are the watershed. Even while histories matter, what workplaces do is critical to how long older workers can sustain employment. Our case studies reveal strategies that succeed, those that do not, and that workplaces are asking for support from government. So one of our project studies was an online survey of human resources and health and safety managers and personnel across medium and large businesses in Queensland, conducted in late 2018, early 2019. We received over 1,000 responses across a broad range of industry types. The results showed that most respondents disagreed with or were neutral on common negative stereotypes of older workers, but tended to agree with many positive stereotyped characteristics. This suggests that organizations are aware of the benefits of hiring and retaining older workers. We also found that businesses were aware of older workers' health needs, were accepting of an aging workforce, and were concerned about labor shortages. Despite this awareness and concern, however, most businesses did not have systematic strategies, policies, and plans to manage the needs of older workers and were not considering strategies to attract and retain older workers. Only 25% of respondents indicated that their organization was taking active steps to retain older workers over the age of 65. Respondents that had put strategies in place reported higher job satisfaction, increased engagement, and decreased absenteeism amongst its workers. However, those who had not taken action indicated they needed access to health and safety information, financial incentives to retain older workers, and tools to assess the needs of their workers. This gap between businesses' awareness or perception about older workers and their ability to take action suggests room for policy support and direction on attracting and supporting older workers. Workplaces recognized the need for change and wanted change, but needed supports. What about the workers' experiences? As part of the larger project, we conducted in-depth interviews with 60 workers across blue, pink, and white-collar industries. These interviews offer us insights into what works and what doesn't work for older employees. The interviews focused on the lived experiences of the workers themselves, and we asked about what role financial and health vulnerabilities play in older workers' job participation, what job characteristics are significant for the health of older workers across occupation types, and what helps employees manage their health while working, what needs to be improved. Our blue-collar case study, consisting of interviews with 19 mature-age school bus drivers, including their bus depot manager, illustrates some of our project's key findings, namely that health and financial vulnerabilities accumulate over time and culminate in older age, and that workplaces can successfully facilitate extended working lives. So a quick overview of the methodology for the blue-collar case study. It was set in a single workplace within the transportation industry, school bus drivers working out of the same bus depot for a large private transportation company in Western Australia. So it's the common recurring themes articulated by the participants themselves that inform the results for the discussion. So who did we interview? There were 13 men and 6 women, ranging in age from 50 to 71, but most were over the age of 60. Most had not completed their secondary education, and most had low annual household incomes, with 26% earning less than $20,000 a year and another 26% earning between $20,000 and $40,000 a year. So what did we find? One significant contributing factor to their relative financial vulnerability was the nature of their previous work histories, which were heavily weighted towards blue and pink collar occupations. Most of the participants came to bus driving later in life after long periods in the industrial trades, farm, retail, and aged and disability care sectors. Amongst them, several had had periods of extended unemployment or frequent job changes. Most women had taken time off to raise children, with some of out of the paid workforce for up to 12 years. So what these factors meant for both the men and women that we interviewed was that interrupted work histories and relatively low incomes over time had impacted super contributions and financial security, strengthening their need for ongoing work as they approached, or in some cases even worked past retirement age. So indeed, financial pressure was a common explanation amongst these participants for why they were working. Almost 60% said that they needed to work for financial reasons, including to pay off a mortgage, increase their superannuation or retirement savings, and supplement pensions. Not surprisingly, participants' health histories also ran parallel to their work histories. About 50% of interviewees attributed their current chronic health conditions, like back pain and joint deterioration, to previous industrial or manual labor sustained before they started bus driving. So you can see that for the people in our case study, several were trying to negotiate between the need to remain employed for financial reasons with ongoing health conditions. And when we analyzed the interviews, we found that there were several features of their workplace that allowed for the tension between these two push-pull factors to be mediated. Specifically, we found that the organizational structure and culture at the bus depot facilitated the management of workers' health conditions and allowed them to continue to work. So let's have a closer look at these workplace characteristics. One of the key factors allowing for these employees to contribute or to continue working was the appropriateness of the job requirements. So these were well matched to their physical abilities. Driving school buses accommodated their physical needs because, as they explained, it required little physical effort. The seats were cushioned and comfortable. The vehicle was easy to operate, as it was an automatic with power steering, and there were aides assigned to the bus routes. So drivers were not charged with the management of the children while also driving. So on a very basic level, the job requirements of bus driving were appropriately matched to the physical needs of these older workers. But one of the most significant workplace characteristics allowing these drivers to manage their health needs were the flexible working arrangements at the bus depot. So split shifts were crucial in helping them to manage their health conditions. Typically, the same person would drive their route in the early morning and mid-afternoon for the daily school runs. The hours that they had off between these shifts provided them with a valuable window of time to attend medical appointments and, importantly, to take a nap, a point made by many of the bus drivers. Timetable flexibility and tailored weekly hours were also very important. In this case, the bus depot manager organized the drivers' schedules around existing health issues. For example, one driver with kidney disease worked with the manager to organize his shifts around his dialysis schedule. He worked in the mornings on his dialysis days, took a day to recover in the middle of the week, and worked around his dialysis for the remainder of the week. Crucially, the number of weekly work hours, not just when, but how many, were tailored to employees' needs. The manager planned the timetables with employees one-on-one, so they were highly personalized and contextual. However, another reason tailored hours were important for this group of workers was that they had quite varied financial situations. While some were trying to earn enough to finish paying off their mortgage and wanted more hours than others, some employees could not work beyond a certain number of hours without negatively affecting their pension income. And finally, in terms of flexible working arrangements, there was a regularly rostered replacement worker on call each day from 6 a.m. for 2 hours. There were also other contingencies in place, with certain drivers identified as good fill-ins because they knew the bus routes very well, and even the manager was able to fill in if needed. This way, sick employees could be covered at short notice with little disruption. So by now, you're probably getting a sense of the importance of the manager's role in employees' ability to manage their health conditions while also continuing to work. Almost all of the participants stressed the importance of their boss in helping them manage their health needs and in their enjoyment of their job. Their boss was a linchpin in their ability to manage their health conditions while remaining employed and in the job satisfaction and loyalty that they described. The work culture fostered by the manager was deliberate, and his accommodation of employees' health needs was one manifestation of his management style. So he took an open door policy with his employees, consciously taking the time to speak and listen to them. And as you can see in this quote, he was very patient. He recognized that often it took a little bit of time for people to open up. Importantly, being aware of his employees' concerns, he was able to better support their health needs. He also explained that he valued older workers. He valued their experience, and he recognized the importance of being able to offer reliable workers what they needed in order for him to retain them. He also acknowledged that their employment needs suited what he could offer them. The work culture amongst the bus drivers was also conducive to the management of ongoing health needs. The drivers frequently described their workplace as egalitarian. There was a sense that all employees, including their manager, were equal, in part because he had worked his way up from driving buses himself and would willingly fill in for the drivers as needed. There was also a sense amongst coworkers that they were a team, and like family, nobody wanted to let anyone down. This culture of egalitarianism, teamwork, and support had tangible health benefits. For example, one bus driver developed epilepsy. He was no longer allowed to drive and was going to have to give up his job. But his bus aide suggested that he could keep working if they traded roles. So while he was recovering from the infection that had caused the epilepsy, she was learning to drive a bus. Other coworkers took turns covering their driving and aid duties while they were both away. When the man recovered, he resumed working his bus route as an aide, and once trained, the aide drove the bus. So this allowed him to keep working with his health condition and for that pair to continue working as a team. So what works? How do we make longer working lives more feasible and fair? What allows workers to stay employed and meet their financial needs while managing ongoing health conditions? For this group of employees and their manager, job requirements that are well suited to the physical needs of their employees. Flexibility, the ability to calibrate work days and work hours according to varied health and financial needs. Importantly, this flexibility was employee-centered and offered workers the agency and autonomy to plan their work hours. Regularly rostered employees who could cover those who were sick. A manager with emotional intelligence who was attuned to employee needs. A manager who had the autonomy within the organization to craft work arrangements specific to employee needs. A workplace culture that values older workers, a workplace characterized by egalitarian and positive working relationships with coworkers, and an employer that pays its employees well. All of which, in this case, led to high workplace satisfaction and organizational commitment, which, along with the ability to integrate health management into their working lives, encouraged and allowed this group of older Australians to remain employed, showing us that there are workplace practices that can engage people who are less than optimally healthy in job participation. And another thank you to our partners on this project.
Thank you, Christine. Our final speaker in this session is Tim Rawlings. Tim is the Director in the Education Practice of PwC and Head of Training Product Development at PwC Skills for Australia. He's working with education providers and employers to build a system that produces graduates with the right skills to attain a job and build a successful career. His current role is focused on ensuring skills-based education is relevant to industry needs, giving graduates the best chance of employment and boosting national productivity.
I think we can all resonate with Joanne, the 68-year-old from the previous presentation, who will enjoy a good granny nap. And I appreciate coming on at the time when the granny nap would probably be most appropriate. So I'll try and keep it a little bit high octane. I don't have any slides, as you can probably gather. I'm not a researcher. I'm from PwC, one of those multinational professional services firms. I hope you weren't talking about my team when you were saying that it was falling apart. But I come from, well, it's interesting that I start there because I do come from an organisation that historically used to have age discrimination against partners. And it's only very recently that has actually stopped, that partners don't have a mandatory retirement age. And I come from an organisation that probably has an average or median age in the mid-20s. So, you know, a lot of the experiences that I have in my day-to-day working life, I've relished reflecting over the last sort of hour and a half on how my job and my team could be better if we did embrace mature age workers more. In every form of inclusivity, I'm proud of my organisation and I'm sure that we could do that one as well. Last year was a difficult year, and particularly difficult for those of us who have teams in Melbourne and friends and family in Melbourne. And my most valuable person last year was I won't say her age actually, she was a mature age worker who worked in Melbourne. She also won the I'm on Mute award at the end of the year for the person who most frequently was told that she was on mute. But she probably won the most valuable person out of the 40-odd people in my team as well, because when people were suffering mental illness, anxiety, worry, and all the things that came from lockdown and are being exacerbated again, she was the one who brought them over to her house, cooked them dinner, the one who talked them through tasks, the one who gave them perspective. And so from that very, very small sample size in a group of researchers, I know that if an organisation like ours had more mature age workers, I know that it would be a richer environment. But I'm here today to talk about a couple of things. The role that I have at PwC is in a thing called Skills for Australia. And PwC Skills for Australia does two things. One, it works within the national, particularly vocational education and training system around how do we have future fit qualifications that are accessible to the Australians who need them. That includes writing national training packages, but also working on things like qualification reform, VET for school students, and a bit later on I'll talk about a pilot program that we ran for long-term unemployed mature age workers. The other side of the equation is we work with businesses. And we work with businesses around the challenges that they face around upskilling. And I've enjoyed the presentations over the last hour because I really think that often our response is to look to government to be the solver of all of our problems, when in actual fact it's the businesses themselves. Once people are employed and once people are in their careers, that's where we can get the most gain and most bang for our buck, because at the moment that's the greenfield. That's the one that's not necessarily working the way that it should. So I might start there because one of the things that we saw over the pandemic, like all recessions over the last 50 years, has been that there was an exacerbated drop in the number of workers in routine jobs. So what has happened over time is that routine tasks, and therefore jobs that have routine tasks as their prevalence, so therefore routine jobs, have exited the economy. Non-routine jobs, or jobs that have non-routine tasks in them, have entered the economy. So as the robots come in, the humans need to become more human. And so the robots can take, all of those tasks that are routine in nature. Now, just because something is routine doesn't mean it will be automated. I don't think we're going to get onto a plane anytime soon that doesn't have a pilot, or into a bus that doesn't have a driver. But it's relevant because what happens in times of recession is that there's a steep kick in the sort of rate at which that decline or that erosion happens. Now, we've known this for some time, and yet we haven't really done a great deal about it. We know that over the course of a person's life, they'll now have 5 different careers and 17 different jobs. Now, when a mature age worker was starting in the workforce, that wasn't the case. That has accelerated over the last decades as technological changes come in, and particularly since the late 90s with the advent of the internet and all sorts of AI and automation that we see in our workplaces. What we need to do then is we need to make sure that learning and development and upskilling is not something that is done firstly at the beginning of your career. So recent research has shown that 80% of our institutional learning is done before the age of 21. Now that makes sense. You do things in school and you do things in university and you go into a job. Unfortunately, we are still part of a system that sees a qualification as the first stepping stone to then a job for life, or at least a general broad band of skills and employment for life. We have a system in Australia where, for instance, you get if you don't know this, you get a Certificate 3 guarantee. You can go and get a Certificate 3 to make sure, and that's government's recognition, that that's the level of skill that we need to have skilled people in the workforce. So we make sure that there are no financial barriers to making sure that a person can get to an AQF3, Australian Qualification Level 3 qualification. But every state has an entitlement to that, which means that it gets exhausted the first time you use it. And that isn't necessarily conducive to lifelong learning. We have a system that is founded on the qualification rather than, say, the component parts like units of competency, subjects or micro-credentials. What that means is that when we ask people to reskill, we are asking them to reskill in big, bulky qualifications. We're asking them to leave their workplace. We're asking them to prioritise that upskilling, that qualification level upskilling, which requires, in many cases, full-time dedication over family commitments, over job commitments, and as a result, people just simply don't do it. If we treated the way that we should go to the gym, the way that we treat our upskilling, we'd probably go to the gym for 1 week a year and then we wouldn't go for 51. Maybe that's a better way. Maybe it's 1 week more than I currently go, so that could be good. What we should have is a system where people build up and continue to build on their upskilling. We've talked about lifelong learning for a long time, but the systems and the architecture in place doesn't necessarily support the notion that individuals can build up their skills over time. Now, why is that important? It's important because if jobs are eroding at a task level, if jobs are being automated because component parts of those jobs are being automated, then if we can iteratively upskill, we can sort of inoculate, to use a topical verb, ourselves against that automation. We don't wait until the point that the job has been automated. We don't wait until the point that the organisation says that one person can do the job that two used to be doing. We are constantly having this approach where people upskill on a 45 minutes a week basis or a 1 day a month basis, and they keep accruing skills, which means that the options that they have at those critical junctures in their life, or perhaps they don't even get to those critical junctures because they move ahead of the need. Whereas at the moment what happens is you have a warehouse worker, the warehouse becomes automated, that worker then goes into a system that is about career advice, about rapid upskilling or sort of bulky upskilling. And what we see is that these people don't re-enter the workforce. They end up being long-term unemployed, and then it's much more difficult to get them to re-enter the workforce because it's much more difficult to have a relevant CV. It's much more difficult to give them the upskilling that they need in order to access those new jobs. And as a result, they go and try and find whatever job that they can rather than a job that is truly fulfilling and properly utilises all the skills that they have. So for me, that's a risk because from everything that I've heard in the presentations that have just preceded mine, we don't even get them into a situation in the workplace where we can do some of those really great things around inclusion, where we can get all of those really great traits that they have and add into the cultural mix. If we didn't have that mature age worker in my team last year, I know that the results on our people surveys would have been shocking compared to what they were. I know that the mental health of my younger team members would have been a lot worse than it was. We need to make sure that we have those mature age workers in the workplace, and we can only do that if we give them the upskilling that they need along the way in a way that they can digest it into their lives. And that isn't sending them off to do big, bulky qualifications at various points in their life. It is very much about making sure that we iteratively upskill them. One of the things that's happening at the moment across this country is that there is a greater recognition of micro-credentials. Now, we've all heard the term, but up until this minute, we still don't have every jurisdiction funding microcredentials. What a microcredential is fundamentally a smaller version of a national qualification. But we can't just rely on the national system to be the one who provides the upskilling. Most people's upskilling comes from within their own organisation. It comes through informal learning. It comes through what I'll call corporate learning and development or enterprise learning and development. We need to make sure that there is a more targeted approach to that sort of upskilling to support the national system. Because the national system is very good. We have a very good national education and training system here in Australia. We're constantly looking at ways to improve it. We probably change it too much in order to try and improve it. But by international standards, we have a very good one. But like every national system that has rigour and every national system that is supported by quality, it is slow to respond to industry needs. It is slow to change in terms of its funding arrangements. And so we need to look at other ships in the armada to help us to have that iterative upskilling. And that's where organisations can play a real role. The role that organisations can play is to make sure that they look over the horizon and they say, these are the jobs that we think are going to go. And this is how we are going to inoculate people against that sort of wave of automation and help people ride the wave of technology rather than be dumped by it. Because if we don't, we'll end up in a situation where we have long-term unemployed older workers. And with a couple of minutes remaining, I'll just touch on a pilot that we did last year in Western Sydney. The results weren't shocking. We knew that older workers would struggle to re-enter the workforce if they've been out of the workforce for 2 years. We knew that the financial burden on the Commonwealth would be massive if we didn't get these people back into work. You know, all of those things are pretty obvious. Some of the things that struck us, though, are important in terms of how we address the problem. We found that face-to-face engagement, rather than using digital tools, was hugely beneficial. And it came for two reasons. One, the familiarity with the digital tools, but two, the push for efficiency and being customer-centric in a digital sense just didn't resonate with the cohort. We found that it took 3.2 interviews or contacts on average to get an employer across the idea that a mature age worker who had been out of the workforce could be relevant to their organisation. And the main things that we found were that aligning that person's skills and the general concept of having a mature age worker with their organisational needs and organisational strategy was critically important. The third thing is we found that there was actually a balk against formal training, and if you could, as I started to term it, hide the veggies and get the training in amongst the interaction and the career interaction, we found that people's digital upskilling was enhanced and they were much more likely to then go and do something that was more structured. We found that they didn't want to do big, bulky qualifications. We found that they wanted to do short courses. And so what I want to leave you with today is there are these pillars of upskilling that we're going to face and we're going to continue to face. It's going to be sped up. We're going to continue to have automation and artificial intelligence automating tasks. And if we don't get an approach that means that we have lifelong learning, iterative upskilling to help inoculate ourselves against that, we will be left with the wicked problem of having long-term unemployed older Australians, and we risk having all of the things that we've seen in the previous presentations play out on a much greater scale as people seek to stay in the workforce. It's something I'm very passionate about. I believe that we have an untapped resource. We have a skill shortage in Australia at the moment. We have a skill shortage. Everyone is desperate for staff, and I believe that mature age workers are something that is not being looked at in the way that it should be. I promise, and the challenge that Sandra raised, I promise to take that back to my workplace, and I encourage you all to do the same. So thank you very much.
We do have a question from Myra, who was supposed to be the chair of the session. She says, thanks, Christine. I noted that most of the health concerns among participants were physical health conditions. Was there much discussion of mental health?
Thanks for the question. There were some participants who had had mental health issues in the past, and that had led to them leaving those particular jobs. In some cases, it had been quite a rupture for them in their lives. So there were a couple of cases of depression, and that meant that they left that business altogether. You know, for some people it was their own business, and then they did have extended periods of time off. But there wasn't, I don't believe that there was any discussion of people who were managing ongoing mental health conditions while they were employed at the bus depot.
Great, thank you. Marianne?
Thank you. Question for Tim. At the end there, very interesting to hear PwC's approach. Thank you. And I'm curious to know how Australian employers compare to employers in, say, let's say, other OECD nations in terms of their investment in training, whether it be small chunks of training or total blocks of training. I mean, I've always understood, and I may be wrong, and I'd be really interested to hear that Australian employers are very resistant to investing in training and development of their employees.
So I would just repeat that question for the people at home who can't necessarily hear the audience. Sorry, I should have told you that Tim came late. So the question was basically, do Australian employers compared to OECD employers have the same attitudes to investment, I guess? How much do they invest?
PwC's Global CEO survey found a really interesting dichotomy. 75% of CEOs said that skills is one of the top challenges that they have, finding relevant skills. But 75% of their employees said that they weren't upskilled in the last 12 months. So there's a real issue there globally, and that's a global CEO survey. And Australia's results were no different to, there was no real market difference between Australia's results and the rest of the world. Now, that is a subset of businesses that are obviously large. We interviewed those CEOs, so maybe, it's skewed. I agree with your observation, though, because from our work in the National Vocational Education and Training System, one observation I'll make about sort of the Australian training landscape is that people look to the national system to solve all of the upskilling problems. The system is very good for initial training and upskilling. As I outlined in my presentation, it is not necessarily as nimble for, iterative upskilling. We released a report in the middle of COVID last year called Where Next for Skills, and our approach was that it needs to be a business-led, government-enabled upskilling approach. So, for example, how can we have a national structure of recognition around enterprise-based micro-credentials or enterprise-based certifications? So, an organisation, a large mining company or a large financial services company has their own credentialing system, but we have a way of making sure that if that person leaves that organisation, it's better recognised. Basically, it was our way of trying to say organisations really need to lead the next charge, because otherwise we'll just keep shuffling the cards on the national system and going through system A, B, C, and then back to the beginning. So I sort of intuitively agree and from my experience agree with the sentiment, but our Global CEO survey probably didn't bear out that there was any difference to other OECD countries.
Any other questions?
Can I just jump in on that one? I think I've got my thing on. I think the other thing is the importance of organisations facilitating training through informal learning, which I think is what you also said. So it might not be reflected in a training budget, for example, but if you allow or encourage employees to rotate or be seconded or to job shadow other people, those are very powerful sources of learning. But again, organisations are not necessarily very good at orchestrating those. So I would just say that's, to me, also a really critical part of the puzzle.
Yeah, probably just a couple of stats. So TAFE New South Wales did a survey a couple of years ago. The average business in New South Wales spends about $1,600 per year per employee on upskilling. However, once a business gets over 100 staff, they tend to ignore the national system and do what I would call subsistent upskilling. They do it themselves. And so one of the things that is interesting about that 75% of people don't feel as though they're upskilled is if all of those businesses, huge numbers of businesses are upskilling themselves, but their people don't feel as though they're being upskilled, that's a real challenge and a real problem that we need to address.
Anyone else like to ask a question?
Just a question for Christine. What was the recruitment strategy for the bus company? Did drivers recruit each other, or did they actively go out and seek older workers?
So just for the people at home, the question is about what was the recruitment strategy by the bus company?
I'm sorry, I can't answer the question because the data was actually collected before I joined the project, and I don't have that information within the data. What I can tell you is that The person who conducted the interviews checked back in a while later, I think it was maybe 2 years after she conducted the interviews, and what she found was that the bus depot manager had left, and eventually a lot of the staff who had been so loyal to him and to the company left as well. So it really reinforced what we had found in terms of him being really salient and crucial in helping them stay employed.
We just have time for 2 more questions. So, Imogen?
Hi, thanks. I think my question is best posed to Sharon, because I'm interested in individualisation for older workers. What are your thoughts in terms of how organisations and managers can standardise non-standard work arrangements?
Well, I guess, first of all, there needs to be that acceptance as to why you need to allow non-standard or idiosyncratic or crafted sorts of work opportunities for people. And so I think that's the first thing, is recognising that there's value in that. And that relates to, using people's strengths. And, that relates to the sort of strength-based movement and things. But it also relates to accommodating the different needs. And I think that the case study you talked about was a beautiful example of the individualised strategy, actually. People had all these idiosyncratic health issues, and the manager, the local manager, was able to autonomously sort those out. So I think if you've got that acceptance, and then you can train your managers in how to do it, recognise, reward your managers in doing it as well, then I think you'd be a fair way down the track. I mean, obviously you can also have sort of organisational level policies about flexible work and so on, and that's important. But there's also that, and this is why I think we sometimes see, and we saw it, I think, in some of your research, this gap between what employers say and what employees say. Is it's one thing to have the policy, it's another thing to actually have it locally enacted by the manager. And actually, that's what I was going to say, your survey of HR managers doesn't surprise me. That's really positive. Sort of what HR managers know they have to say. I think if it had been managers, it might have been perhaps a little different. But even then, they sort of know what they have to say. But it's what they do that's important, not what they say. So, yeah, maybe that's a starting point. That's a bit more of a bottom-up strategy. So, there's the top-down, the practices at the org level, and let them flow down. But there's also got to be that bottom-up through training and recruitment of the right sort of managers.
Daniela wants
Maybe
to...
I'll add, because I was reflecting on your question in a different way, what stops flexibility kind of being supportive? And it is a lot around policies and kind of actually implementation of that. And in our work, we also find that it's a lot about systems. So, for example, in our local governments, they acknowledge that flexibility and idiosyncratic needs will help not just for mature workers, but also younger workers, because they want younger workers, but the systems and technologies, like management systems, are so ingrained that they can't see how they would manage and be able to allow like job sharing and more casual work or more part-time work. And those systems take some investment and some really good thinking of changing so that they allow these behaviors to happen, and sometimes they can act as a barrier.
We just have one last question, John.
We've got time. So my question is directed to Tim. I was interested in your finding that larger firms offered in-house training, or the managers said they offered in-house training, but the employees didn't perceive it as such. So economists often make the distinction between firm-specific training and general training. So one speculation would be that what larger employers offer is firm-specific training, which actually doesn't carry much value into the open market. And I was wondering if you would react to that.
Yeah, I think that's a... Sorry, do you answer a question?
Oh, yes.
Okay, just jumped in. I think that's fair. I think the other observation I would make is that you've got mining companies, financial companies, retail companies who are then acting as education organisations. And a lot of times they've got very good systems, very good platforms, very engaging platforms that are unfortunately underutilised. They've got a lot of good content, but it's not necessarily structured into how that links to someone's career progression. You know, one of the things that I've observed is that come end of year processes, there'll be a lot of sort of subjective commentary about a person's development points, but seldom will there be a direct link then to the training that's in their system, which I'm sure exists, that could help them with that. I think the other thing that links into your comment is I think there will be a proportion of the training or it'll be a mix between being firm specific and sort of what I'd call general or transferable. So for example, you might upskill in Power BI and Alteryx and you're generally upskilling in data. So the data, you know, wrangling and data presentation skills can be used somewhere else, but they're probably taught in a way that makes it highly relevant to that organisation. But there is no way of telling the next employer what you've done and how you've done it, because there's no sort of either standard taxonomy or structure for that. So therefore the utility for the individual when they go to the next job might as well have been that it was firm specific, even though they have, you know, sort of been upskilled. So I think that that corporate learning and development and in-house learning and development, it needs to better link to the national system. It needs to be more linked to an individual's career so that, you know, when they change jobs, they're either upskilling for a new job or a better job. And it helps them do their current job better in a way that means that they won't succumb to automation and AI, or at least a less of a chance to.
Okay. If I could just chuck in one more thing, the piece I would add to what you just said, it goes back to what we were just talking about, is also that local management support, because often the training's available, it's in the system, it's beautiful, but the local manager won't let them. They won't release them from the work because they know that it has consequences for other people's workload and all that sort of thing. Yeah. So there are those practical, logistical issues.
100%, and rigour is probably the other thing. Learning and development in a lot of these systems may not be as andragogically rigorous as you might get in an institution like a university or a TAFE. And a lot of the times that's because it's not assessed. It's more of a knowledge transfer rather than true upskilling.
Okay, I think we need to wrap it up there. So please join me in thanking all of our panellists for the session this afternoon.